Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and this is another episode. I'm excited to have our guest today with us, Liam Kelly. He is a LPC-Associate counselor here in the state of Texas. He deals with a lot of patients and a lot of clients that have addictions. And for those of you that aren't watching this podcast that are maybe listening to it, Liam, welcome. Give us your the name of your counseling center and your website.
Yeah, thank you for having me, Hal. So our center is called Grace Counseling. We're in Louisville. Our website is www.grace-counseling.com. So that is a hyphen in the middle, not on the bottom. They make sure to tell me that. So grace-counseling.com. And then a good phone number if you want to call is going to be 800-972-0643.
Great.
Yeah.
And if there's people listening to this in other states, do you guys do online counseling too for anybody anywhere?
Yeah, so we can't do online because we're only licensed in the state of Texas.
Okay.
But we would still advise, give us a call because we'd love to plug you in with rehab centers or wherever in that state.
Okay.
So
fantastic. Great. Liam's going to talk tonight about addiction. And, there is a difference between, let's just say, alcoholism, being an alcohol addict and having a drinking problem. So we really want to get down to the nitty gritty of what is an addict, what makes people become addicted, not just to alcohol, but different addictions, because the kind of the MO is the same on all of those. So Liam, I'll bring you in now. Welcome. Glad to have you again.
Yes, thank you. I'm very glad to be here. It's a wonderful opportunity. Thank you. Yeah.
Well, I think that people need to, we go to a doctor for physical, our physical well-being. We have a sore throat, a stomach ache, whatever. We don't really think, and you're not a psychologist or a psychiatrist, but a lot of what you deal with has to do with, emotions and there's nothing wrong with emotions. God gave us emotions.
Sure.
But we specifically, and when we were talking about you coming on the program, wanted to address addiction. So, I'll just start off. What is addiction? Just describe what that is.
Great question, because I think it's something that a lot of people maybe misconstrue. You opened with the question of what's the difference between somebody who maybe has some problem drinking versus who actually has an addiction. So what I would want to make clear is that, addiction is a brain disease. It is surely a psychological, environmental, but it is also chemical. It is also scientifically happening within the brain. And so it affects about 5 to 10% of the population, the world population, have this.
Are you specifically saying addiction to alcohol right now, or just an addictive personality or whatever?
Yeah. So another distinction there, addictive personality, somebody might classify somebody with an addictive personality, but they might not have the brain disease of addiction, right? They might just really like to, put together Legos on a weekend or something. That doesn't mean that they're an addict. But no, good question. So I'll kind of use the acronym AOD. That just stands for alcohol and other drugs. So this is, and the reason why that's all grouped together to continue to explain the brain disease, these types of mood altering substances affect the same portion of the brain. The same dopamine center of the brain is being affected. This is why you'll get a lot of clients, well, I'm addicted to cocaine, not alcohol, so I should be able to drink alcohol, right? Well, that's not the case for those who have the brain disease of addiction. That dopamine center is still being uh, um, manipulated with that mood altering substance. So AOD, this is anybody with any addiction towards a mood altering substance.
Okay.
I know a little less, and it's not quite in my wheelhouse as far as gambling, sex addiction, things like that. Though there are similarities, that's not within my education to know that.
Would it be fair to say that all types of addiction involve on a biochemical basis a dopamine release?
Surely I could probably guess to that. Again, while I don't know anything about gambling or sex addiction in specific, and I shouldn't say anything, but just I don't know specifics about those.
But
Certainly there's
certainly with chemical addictions, that's the case. Right.
exactly, and certainly
Yeah.
there's a dopamine effect there.
Yeah.
Um, and so there are also like how does one develop an addiction essentially is a kind of the question, because there's stages of addiction. This is really where to dig a little bit deeper, what is addiction? If you can imagine like a light switch within your brain, for the addict, that isn't activated until a certain point in their drug abuse or alcohol abuse. So if you can imagine it in 4 phases, you have the introduction phase, the maintenance phase, the disenchantment phase, and the disaster phase. And I'll try to go through these a little bit quickly, but essentially the intro phase, people have very little cons to their use, right? They're drinking alcohol occasionally, snorting cocaine at a party once in a while.
It's like anybody else doing it.
Sure, as the AA people, the Alcoholics Anonymous people call them normies, just regular people.
Uh-huh.
So they're casually using. Once you hit the maintenance phase, which you can hit this phase without having an addiction, without having the brain disease. This is when your cons start to outweigh the pros. You're starting to use more regularly. Maybe you're calling into work on Mondays because you're binging every weekend. Maybe you're having some relationship issues, some financial issues, physical issues. However, in the maintenance phase, for the most part, the pros outweigh the cons. Whatever you started using the substance for, maybe it was to relax or emotions, or I'm using air quotes here because, do they really help? I don't know. But whatever you were using that for, it's still giving you that pro. It's still giving you that benefit
Okay.
within the
So in
maintenance.
the maintenance phase, the pros are still outweighing the cons.
Yes. And then
Okay. You're being sucked in.
right. And then once you hit the disenchantment phase is where that light switch I talked about earlier, this is typically when that light switch gets turned on. This is when the negatives outweigh the pros. So your finances are in the, really down. You're having some really like liver issues for alcoholics or nosebleeds for cocaine addicts, whatever it might be. You're having some physical issues, and the list goes on and on: emotional, financial, social problems.
Is it at this phase that someone realizes that they have a problem, that they are addicted? Do
Yeah.
they realize that in this phase?
So great question, because I like to make this distinction. I think this is important for us normies, or for people who are more normal to understand, is that, use this analogy. There's 2 people who have the exact same job, who work the same hours, who go to the same place, right? They're both at the bar. It's late one night. They're using cocaine. They're using alcohol. And one of them says, "Oh my gosh, look at the time. We got to be up at 6 a.m. I'm going to go home." And the other one says, "You go on ahead. I'm going to have one more drink. I'll see you tomorrow." Well, that person goes on to do a 3-day bender and lose their job, the one who stayed at the bar. So this is the difference between someone who can be in the disenchantment phase and not have the brain disease of addiction. They are able to recognize the issue and to step away from that. Typically,
Okay.
when you get to the disenchantment phase, if you don't have the brain addiction, you have the capability to step away from the substance long term, with pretty significant results, right? Like alcohol has, let's say hypothetically, has ruined my relationship with my spouse. I will quit it and I will never touch alcohol again. And that person who doesn't have the brain disease will probably relatively be successful in that. The person who has the addiction won't have that ability. The brain disease has been, the switch has been turned on, even amidst the surmounting cons that are piling up for them. They won't be able to step away from the substance. And then the sad truth is that at times it can get to that disaster phase where now there are no pros. Typically, people at this stage are using only to avoid withdrawal symptoms. So this is where you'll hear the story of the alcoholic who wakes up and has the shakes. They'll take one shot of whatever, they'll throw that up, they'll take a second, throw that up, and then the third one stays down and they kind of stop their shakes, and that's how they start their day. So you're getting to a point where you don't experience the high, you don't experience the quote unquote buzz. You're maintaining your addiction, and you're fully chemically dependent at that point, for sure.
And that's that was the fourth phase.
Correct. And this is the sad thing for that
What
too.
was that? The fourth phase? Yeah, I've
It's
been
called-
writing these down.
That's okay. It's called disaster phase.
The disaster phase. Yeah. Okay.
So introduction, maintenance, disenchantment, disaster.
Yeah, okay.
And the sad truth is that, you said this to me before we started the podcast, nobody starts, using cocaine or smoking crystal meth thinking I'm going to be addicted to this. They start drinking or using to help with whatever, quote unquote, help with whatever issues they may be experiencing.
Yeah.
The sad truth is that they don't know that they have the predisposition to that biological, genetic, chemical brain disease of addiction.
Yeah. Well, as a practicing a healthcare profession, I'm certainly not trained to deal with addiction, but we are trained as dentists to kind of maybe recognize some of the traits of addicts and, more chemical dependency things. That's what we're more concerned about, because that affects their physical health. What does I guess what does an addict? I don't want to say what does an addict look like. I'll rephrase this better. How does addiction affect the addict, and how do you know if someone has an addiction, whether you're that person or you're someone close to them?
Right, you're a loved one. Great question. And I like that you put it that way, because there's no one type of person. I think we're coming away from that as a society, but I believe that the societal view was the gangster, druggy looking person, and that's you have very quote unquote successful people who are financially stable, successful in their careers, who have addictions. So there's no one type. I think what I would say, how do you know if somebody has an addiction? Their dopamine levels are increasing. They're having to increase in use. That's kind of a sure sign. And we want to look at the negatives, right? I just talked about the pros and cons, and we're really looking at the cons. Are you, is that person experiencing financial issues? Are they experiencing relational issues? Are they having body damage, emotional dysregulation? All of those things are what we're looking for. When we do a screening at our practice, we're doing a full family kind of check-in as well. What's your spouse say about this? Family members, social, you'll find an indicator about that too. With someone who truly has an addiction is, what do your friends think about this? And they'll typically answer, I don't have any friends, right? Their addiction has taken them to a point where they other people can't keep up, quotes in quotes. Like addiction is a very isolating brain disease. it isolates the person from everybody because this person just challenges me about that addiction. That person just doesn't really get me.
Yeah.
And it's an interesting thing too that we see in addiction of people start to develop a relationship with the drug. They feel like it's a relationship, that they're in a relationship with that drug. Um so how do you know if somebody has an addiction? We're checking for all of those factors. We want to see increased use. I mean, that's the other thing is we're going to ask the person, how much are you using on a given day or a given basis? Now, one of the symptoms I will say, and it is a symptom, is lying. A symptom of addiction is lying. Just like the person with the peanut allergy who eats the peanut and their throat swells up, we don't judge the addict for lying. Like you don't want to, it's a part of their addiction. It's a symptom of what they're going through. So it can be difficult, especially for family members, to get that person to come to the reality of what's actually happening to them. That lower brain, that limbic system, if we had time to go into it, I'd go into it a little bit, but it's needing the drug at this point. It's chemically dependent. It's
Mhm.
going to justify, it's going to lie to the person themselves as much as possible. So it can be difficult. That's why we want, what we call in the counseling world, collateral. Like we want the family members. We want what's your medical history like? Are your emotions up, down, left, right?
Mhm.
Have you tried to quit? That's also a good indicator. Have you ever tried to quit? Okay, what happened? Well, I threw up or I passed out or I had seizures or whatever, okay, well that's probably a pretty good indicator that you're chemically dependent, you're addicted. Um,
Do
so
you see
yeah,
that? Do you see that with a lot of people, it's finally something happened that they or their family, or it affected somebody some way in a really, really negative way that they love, maybe that's close to them, or maybe them, maybe they drove off the road, alcohol addiction, and ran into a tree, and could have killed themselves.
mhm.
Is it
This is
usually something? A lot of times it's something like that when people decide to seek counseling.
what a really good question. The sad reality is that, well, there's two things that I want to address here. Number one, the misconception that people don't have to hit a rock bottom in their addiction. I see the sad truth of, and I understand why. I don't judge them for it, but I hear family members say, well, they're just going to have to hit rock bottom before they can. And, certainly maybe that is true for that person and that breaks my heart, but that's not always the case. That doesn't
Yeah.
have to be the reality. Um, Certain people seek treatment because they're legally obligated. They've had 3 DUIs or 4 DUIs and they have to go
Mhm.
on probation or parole or whatever it might be. Um the really like heartwarming and exciting thing about addiction work is that you don't have the individual does not have to be voluntarily involved in their treatment in order to get success. There's statistic after statistic that shows no matter the reason that you're here for treatment, it can be successful if you stay within it for the long haul and you
Yeah.
kind of put forth your worth. I forgot your question. I had two things. I can't remember the second one now.
Well, we were talking about how it affects the addict, and
Right.
how do you know if someone has an addiction? I think you addressed that really well. To me, treating treating what you treat, and I know not every client you see is suffering with addiction. There's other things that but that's certainly probably one of the big ones.
Yeah.
And it's just it's amazing to me how you can go about doing this, but
Mhm.
it's not a quick fix. It's not like going to the doctor and getting a shot for anti-nausea and then it goes away.
Yeah.
It's a step process. What are the different levels of help that people seek out or that are available to people?
Good question. And I'd love to also go in if we have time about kind of that longevity because you're right, it's quite a long process. But really what I'll touch briefly on what levels are out there. So what help can people seek? Um, and I'll go from highest level of care to typically lowest level of care. So the highest level of care is going to be a rehabilitation center or like a detox center. Um, some people, um, excuse me, because excuse me, I had something in my throat. Two substances that you can die from withdrawal: alcohol and benzodiazepines. So I like to be very clear with anyone, even if they just feel like they're a problem drinker. I don't really have an issue with alcohol, but I'm going to quit cold turkey. It's my advice. Always seek medical assistance with that. Talk to a doctor
They could actually die from
from
quitting cold turkey
withdrawal.
from the withdrawal.
Absolutely.
Wow.
So seizures can occur, um, which is typically where you see the fatal. They seize up and
Yeah.
head against the pavement, something like that. So you need to really be careful. Most well, if, and someone can correct me in the comments or something if, but I'm almost positive that most other substances you will not die from withdrawal. Um, Coworker of mine made the joke of like, you might feel like you're gonna die from withdrawal depending on the substance, but you will not die. It's best to stay away from the drug. So anyway, but with that, with the detox center, with rehabilitation, they can put you on medications that will help you with that withdrawal process, so that you're able to manage that a little bit more easily. We're blessed in modern medicine to have that, to reduce the likelihood of, literally passing away. So that's kind of your rehab center. Rehabilitation centers, it spans on time. You're there, it's inpatient, you're staying there.
You're staying.
And
Okay. That was my question. You're talking about where you go and you're going to
right.
stay 6 weeks or 2 weeks or whatever.
Yes.
Yeah.
So, our recommendation at our center is, if it's possible, 90 days. I mean, if you can stay there for 90 days, do it. If you can't, so some of these programs are 30-day programs, some of them are 60-day. Some people will come in, you kind of have to go in voluntarily, so
Yeah.
they'll stay for 14 days and then leave, which is a shame. But typically after that, any and all rehab centers that I'm aware of will recommend the next level of care, which is PHP. It stands for Partial Hospitalization Program. That's a 5 days a week, at least how we do it at Grace Counseling. They might do it differently elsewhere, but 5 days a week for 5 hours. Is that right? Yeah, 9 to 2. And this is where you're learning about addiction. You're continuing to be educated. You're seeing a counselor. At our place, at the wonderful Great Grace Counseling Center, to promote my place, we have nurse practitioner on staff. We got rehab counselor on, or I'm sorry, rec therapist on staff, nutritionist on staff. You're seeing your individual. You're doing groups. So they're heavily involved in. We got yoga. So they're
Nice.
heavily involved in full body health, what you promote
Yeah.
so much and what that person needs. So a lot of, just to speak briefly onto the side to this too, is your brain is healing, like the addict's brain is healing. It's gone
Yeah.
through so much abuse for so many years or months or whatever it might be. It's difficult to access some of those deeper issues, realities, because your brain's just healing. So, a lot of times you won't see some of this information click for the client until around, sometimes 3 weeks, so they need, it is crucial that the client be in a program where they're learning, where they're held accountable. Like we do drug tests at our place, um, doing a relapse prevention program, all of those types of things. That was a rabbit trail, but IOP is the next level of care, intensive outpatient. This at least at Grace Counseling and many other places, it's 3 days a week for 3 hours a day. So typically Monday, Wednesday, Friday, very similar. It's just a group process. So similar to PHP, just for less hours. There's another kind of like a step down IOP that some centers do, which I would say is like the next level of care. That's depends on the center. Sometimes it's just 2 days a week where that person has started to show growth and progress at the IOP level. But hey, we want to keep you on the SOP just for a little bit to make sure that you're going to blend well with your new job or whatever you're going
Yeah.
into. And then, the last level of care would really be just outpatient, which is, individual counseling sessions. You might go twice a week, you might go once a week. Just
Yeah.
depends on the client.
So do you usually see people that start with the highest level once they're done with that? If they really are, they go through the whole thing, are they then do they go down to the next level or maybe down 2 levels? So they don't just go, as we use the term before, cold turkey, do they? I mean, once you've gone through like 90 days of rehab and you're all into it, do people still want to stay connected with some type of support?
Great question. Yes. So I think if I'm understanding your question correctly, like if somebody went to a 90-day rehab, man, we would still encourage you to go. Oh, and I forgot to mention this earlier. My recommendation, if you feel like you or anyone that you know might have a drug problem, or I mean, alcohol problem, whatever it might be, addiction, to go to a center to be assessed by someone who is clinically trained to do that.
Yeah. Yeah.
Not to have it, sometimes people have interventions. I'm not knocking interventions, as long as the intervention leads to, let's get you assessed. Like, let's get you somewhere where you're going to have a professional assess you.
Yeah.
So we use what the acronym is SASSY at our location, kind of takes them through an exam almost, that dictates what level of care might be appropriate for them.
Okay.
So you might go through the 90-day program of rehab and get out. We would still recommend at least an IOP or an SOP, depending on where you are. If not PHP, if that's if that's necessary. And then of course, once you're like, here's the, and I say sad reality, but in many ways, it's not a sad reality. It's very empowering to the addict. It's very, it's a good process, but that recovery is lifelong. You never hit a finish line of recovery. As we talk about this being a brain disease, there's not a finish line. You get the gold medal. Now you can go have a drink with your buddies.
Yeah.
It's an entire life of sobriety. The switch has been flicked on in your brain, and that's it. So sobriety, complete and total abstinence is the only option for the drug addict,
Mhm.
or for the addict. I keep saying drug addict, but just
Yeah.
alcohol or drugs.
Any kind of substance.
Mm-hmm.
Because you always hear about that with alcoholics, like AA, you
Yeah.
live one day at a time. But it's really, since all these people have in common the addictive disease,
Yeah.
could be any substance that they're abusing and addicted to.
And
Got to realize that they're always going to be addicted to that. So
right. And they will always have the brain disease of addiction. This is like a lot of common misconceptions too with addiction is cross addiction is often confused. So, maybe I already said this, but I don't think I did. Well, my substance was cocaine, so alcohol shouldn't be a problem.
Yeah. Yeah.
I did, I did. I'm remembering now. It affects the same dopamine center of the brain. So a lot of people relapse on their drug of choice, like cocaine, because they have a drink or because they smoke marijuana or because, and it's a chronic relapsing disease, and it's going to hit the same center of the brain. That's just the sad reality. Yeah.
Well, yeah. And if you're any kind of substance that you're on, you're not going to be making the best decisions. So even though, hey, I'm an alcoholic, but I'm going to do some cocaine. Well, when you're on the cocaine, then you probably are going to want to drink too.
Yep.
That's
how it works. Yeah. Unfortunately.
Well, if someone that has a loved one or someone they know themselves, hey, I got to get help, would the first place go maybe if they have a physician that they trust? Most everybody has a family care doctor that they can go to for guidance. Do most physicians know where to send people or have referrals, or you guys work with different physicians, or they know about you, and how
Yeah.
does that work?
So typically, yes. I can't speak for every single center or primary care physician, but um, yeah, they're going to be able to direct family members where to go. I think, this is really a lot of, like, it's 50% of recovery in my heart for this community is educating the family members. I think that is so crucial, so important. We say this a lot in the addiction community. This is a family disease. It does
Mhm.
not just affect the one individual. And
Yeah,
how could it? How could it?
right,
It's such a
right.
destructive disease that it's affecting the family. So we want the family involved. We want you to feel more equipped and able to help the individual. Um, so if family members can go to a person that they trust, a clinical person that they trust, of course I'd recommend Grace Counseling Center, and get the
By the
education.
way, we have that up at the bottom of the screens for people that
Okay, sweet. Okay, well,
yeah,
yeah, you guys can click there.
yeah.
Um, but we want to, like, here's how we want to empathize with the family. We want to educate the family, but most importantly, we want to help the addicted person. And so if we can equip the family with healthy and effective ways to create boundaries, to engage in leverage, and to really support the addicted person in a way that's not enabling them or causing them to go further, then man, we want to do that, and we want to be on the same page, and we want to save lives. I mean, that's what we're doing here is, addiction takes, unfortunately, so many people every day across the globe. And so we want to empower families and communities and addicted people with the tools. That's where my heart goes, is they just don't have the tools. They just don't have the tools. Man, we want to equip you with that and get you sober and save your life.
Yeah. Well, that's awesome.
Yeah.
Well, we're about out of time, but I want to ask you one more question. Um,
Yeah.
it's not a quick fix. We brushed by that earlier.
Yeah.
Just without making it sound like it's you're going to be spending the next 10 years in counseling.
Yeah.
Uh, strike that, Alexander. I don't like that. So just go back to, I want to ask one. We don't go back, Alexander, go back to, we're, we're, we're not out of time, but I do have one more question.
Yeah.
So this has been great, Liam. We're about out of time, but I do have one more question. And we brushed on this earlier about this isn't an overnight quick fix, and people shouldn't go into it like that. What would you say? Just kind of give a scenario, and I know every
Yeah.
case is different, but just kind of a scenario of the different phases
Yeah.
that you go through with someone to get them well, and to get them on that road to recovery, and get them their life back to normal, and their loved ones surrounding them, and all that.
Yeah. Perfect. I'm glad we went back to this. Um, I'm going to give you the umbrella, okay? Because you're absolutely right. It is case by case. Um, it depends on how much you used, how much you abused, what drug, how is that affecting you? Here is the umbrella timeline that you can look forward to in your recovery process. Day 1 to 15 of sobriety is going to be the withdrawal phase. Typically, again, this is umbrella, but is going to be
Mhm.
the withdrawal phase. This is when you're going to really feel, you're going to feel like crap. You're going through the withdrawals. Your dopamine levels have been raised. They have now completely dropped. Your body no longer naturally produces dopamine, and it's going to wait the 14 to 15 days for you to put the substance back in your body. Typically around day 15 to about day 30 or 45, probably more like 45 or 60, but it depends. We call this the honeymoon phase, because now your body goes, oh, I need to produce dopamine. This isn't going to work. And it shoots that dopamine up. It starts producing that naturally. So you're going to feel great. This is when we encourage family members and addicts this is when you put together your toolbox, get exercising, go to AA meetings, uh, get a relapse prevention plan together, find out coping mechanisms that work for you, go to individual counseling, because you're going to feel good. You're going to feel great. Your body's feeling good. It's producing that dopamine again. However, when you hit about day 45, 60, you're going to hit what we call the wall. The wall is the longest and most difficult phase of early recovery, typically. I'm just, typically speaking. This typically lasts from day 45 to 60 till about day 100 to 120. It depends. Sometimes it's 90, it depends. This is when your dopamine levels are now trying to find a happy medium where what's normal, what's a normal dopamine level for me. So this is when you're going to start, your mood is going to swing. You're going to feel great one day and then you're going to feel terrible the next. I always make the joke with my clients, you're going to watch Finding Nemo and bawl your eyes out. And you're like, why am I bawling my eyes out? It's just a fish. But it's your emotions are going through some weird stuff. You're going to question, is recovery even worth it? I don't even understand why I'm doing this. Why was I doing this in the first place? This is when relapse prevention plans are especially important. Family involvement is especially important. Let's keep the person sober and away from relapse. Once you hit this 100 to 120 days, this is when you're going to start to hit, there's kind of a buffer period here. It's called I can't remember if it's called reestablishment phase. It's something like getting back into the community, making sure you're plugged in with AA. But eventually you kind of get to this adjustment phase is what we would say. And this is kind of you're moving to greener pastures, if you will. And what I mean by that is that you're going to experience less severe mood swings. You're going to experience less severity of mood. So you might be sad, but you may not feel this depressive plunge that you did before. Okay. Your body's going to be healing a lot more. You're going to get a lot more, motion. Your brain will start clearing up. This is when a lot of addicts regain memories, which can be another reason why, hey man, we got to get you in AA. We got to get you into a support group so you're plugged in. But this is when the fog really starts to clear. So I want to plug back to what you said at the beginning. That's not a finish line. It's not 120 days and I'm cured. Right. But it starts to feel more adjusted. It starts to feel, your body feels a little bit more regulated by that point. Yeah.
That was an excellent explanation for that. I think a lot of people they either think it's, a lot longer than that, which it can be for people, or they think it's a couple of sessions and I'm good to go,
Man, so many addicts they've told me talks about with their family, where their family's like, well, you've been sober a month, you can have a drink, right? And it's
right. Yeah.
No, early recovery is considered the first 2 to 5 years, so
okay.
Okay. It's
early
a process.
2 to 5 years. Okay.
Yeah.
Great. Yeah. So the family members really have to be just as dedicated to this as they're.
Yeah.
And I watched that. I think we had watched it before that. My fat addiction, or 600-pound fat addiction. It was that show that featured people that were like morbidly obese, and they go to this doctor in Houston. And he just tells it like it is. And here's what you got to do. Blah, 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 blah.
Oh, I know.
And so it shows them back, at their house. And this patient is drinking a smoothie and their family's ordering pizza. And sitting over there on the other side of the room, it's just like, oh my gosh, they don't stand a chance.
Yes. What a good example of that, hey, I'm quitting alcohol, but there's champagne in the fridge because the mom had, and you're absolutely right. You got to get the family on board. The environment has to be prepared for that person's recovery. Yeah.
Well, Liam, thank you so much. I think that, a lot of people that watch this podcast are healthcare providers, and a lot of people just seeking solutions for themselves or a family member. And I don't, you know, we don't discuss this a lot, but I want to keep you coming you back on a, you know, fairly regular basis, because this is so very important, and because we can do wonders with making people breathe better and feel better, and that's so important. But you know, if they're suffering with an addictive brain condition, that needs to be addressed by people like you. So um, I'm glad that you and your profession exists, and we'll have you on again soon. Okay.
Thank you, Hal. I appreciate it.
You
Yeah.
bet. This has been Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart. Listen to what we've had to say today, and maybe keep your eyes out for somebody that you know and or in love that might need someone like Liam's help. Thank you so much. You guys have a great day. Bye-bye.